What are high blood pressure and prehypertension? Blood pressure is the force of blood against the walls of arteries. Blood pressure rises and falls throughout the day. When blood pressure stays elevated over time, it's called high blood pressure. The medical term for high blood pressure is hypertension. High blood pressure is danger. Because it makes the heart work too hard and contributes to atherosclerosis, hardening of the arteries. It increases the risk of heart disease, CBOX 1, and stroke, which are the first and third leading causes of death among population. High blood pressure also can result in other conditions, such as congestive heart failure, kidney disease, and blindness. Risk factors are conditions or behaviors that increase your chances of developing a disease. When you have more than one risk factor for heart disease, your risk of developing heart disease greatly multiplies. So if you have high blood pressure, you need to take action. Fortunately, you can control most heart disease. Risk factors. Risk factors you can control. Risk factors beyond your control. High blood pressure, age 55 or older for men, 65 or older for women. Abnormal cholesterol, family history of early heart disease, having a father or tobacco use brother diagnosed with heart disease before age 55 or diabetes, having a mother or sister diagnosed before age 65. Overweight. Physical inactivity. Blood pressure level of 140/90ths of a millimeter of mercury or higher is considered high. About 2/3 of people over age 65 have high blood pressure. If your blood pressure is between 120/80ths of a millimeter of mercury and 139/89ths of a millimeter of mercury, then you have prehypertension. This means that you don't have high blood pressure now but are likely to develop it in the future unless you adopt the healthy lifestyle changes described in this brochure. See box 2. People who do not have high blood pressure at age 55 face a 90% chance of developing it during their lifetimes. So high blood pressure is a condition that most people will have at some point in their lives. Both numbers in a blood pressure test are important, but for people who are age 50 or older, systolic pressure gives the most accurate diagnosis of high blood pressure. Systolic pressure is the top number in a blood pressure reading. It is high if it is 140 millimeters of mercury or above. How to control. Being overweight or obese increases your risk of developing high blood pressure. In fact, your blood pressure rises as your body weight increases. Overweight and already have hypertension. Overweight and obesity are also risk factors for heart disease. And being overweight or obese increases your chances of developing high blood cholesterol and diabetes, too. More risk factors for heart disease. 2 key measures are used to determine if someone is overweight or obese. These are body mass index, or BMI, and waist circumference. BMI is a measure of your weight relative to your height. It gives an approximation of total body fat. Exercise 30 minutes daily. Moderate level physical activity a day. You can get added benefits by doing more. Engage in a moderate level activity for a longer period each day or engage in a more vigorous activity. Consume less sodium foods, use more spices. Basil soups and salads, vegetables, fish, and meats. Cinnamon salads, vegetables, breads, and snacks. Chili powder soups, salads, vegetables, and fish. Clove soups, salads, and vegetables. Dill wheat and dill seed fish, soups, salads, and vegetables. Ginger soups, salads, vegetables, and meats. Marjoram soups, salads, vegetables, beef, fish, and chicken. Nutmeg vegetables, meats, and snacks. Oregano soups, salads, vegetables, meats, and snacks. Parsley salads, vegetables, fish, and meats. Rosemary salads, vegetables, fish. Blood pressure drugs. Diuretics. Beta blockers. Angiotensin converting enzyme inhibitors. Angiotensin antagonists. Calcium channel blockers. Alpha blockers. Alpha beta blockers. Nervous system inhibitors. Vasodilators. Tips to reduce blood pressure. Maintain a healthy weight. Check with your health care provider to see if you need to lose weight. If you do, lose weight slowly using a healthy eating plan and engaging in physical activity. Be physically active. Engage in physical activity for a total of 30 minutes on most days of the week. Combine everyday chores with moderate level sporting activities, such as walking. To achieve your physical activity goals, follow a healthy eating plan. Set up a healthy eating plan with foods low in saturated fat, total fat, and cholesterol, and high in fruits, vegetables, and low-fat dairy foods such as the DASH eating plan. Write down everything that you eat and drink in a food diary. Note areas that are successful or need improvement. If you are trying to lose weight, choose an eating plan that is lower in calories. Reduce sodium in your diet. Choose foods that are low in salt and other forms of sodium. Use spices, garlic, and onions to add flavor to your meals without adding more sodium. Drink alcohol only in moderation. In addition to raising blood pressure, too much alcohol can add unneeded calories to your diet. If you drink alcoholic beverages, have only a moderate amount, 1 drink a day. For women, 2 drinks a day for men. Take prescribed drugs as directed. If you need drugs to help lower your blood pressure, you still must follow the lifestyle changes mentioned above. For more details, check description.